Hello and welcome. Today we're diving into a condition that affects the urinary system, specifically the urethra, the urethral caruncle. We'll explore what it is, what causes it, and how it's treated. Let's get started. So, what exactly causes a urethral caruncle? While the exact cause isn't fully understood, hormonal changes, particularly a decrease in estrogen levels after menopause, are strongly implicated. Chronic irritation or inflammation of the urethra may also play a role. Sometimes, it can be associated with the prolapse or eversion of the urethral mucosa. Now, let's talk pathophysiology. A urethral caruncle is essentially a benign growth, or polyp, that develops on the posterior lip of the female urethra, near the external opening. It typically consists of vascular connective tissue covered by squamous or transitional epithelium. Postmenopausal estrogen deficiency can lead to atrophy of the urethral mucosa, increasing its susceptibility to trauma and inflammation, contributing to the formation of the caruncle. The growth itself is usually non-cancerous, but its presence can cause a variety of uncomfortable symptoms. Regarding epidemiology, urethral caruncles are most commonly found in postmenopausal women, although they can occasionally occur in younger women. Due to the hormonal changes experienced during menopause, the prevalence increases significantly in this age group. It's considered a relatively common condition, although precise statistics are difficult to obtain as many women may not seek medical attention for mild symptoms. What are the signs and symptoms of a urethral caruncle? Many women with urethral caruncles may experience no symptoms at all. However, when symptoms do occur, they can include painful urination, also known as dysuria, a feeling of incomplete bladder emptying, spotting of blood in the urine, called hematuria, pain during intercourse, or dyspareunia, and the sensation of a lump or growth at the urethral opening. Some women may also experience urethral bleeding or discomfort. How is a urethral caruncle diagnosed? Diagnosis usually involves a physical examination by a healthcare provider. During the exam, the caruncle may be visible as a small, reddish growth at the urethral opening. A cystoscopy, where a small camera is inserted into the urethra, may be performed to visualize the urethra and bladder in more detail. A biopsy, or tissue sample, may be taken to rule out malignancy, although this is rare. Urine tests may be conducted to evaluate for infection or other abnormalities. Urethral caruncles are not typically classified into different types, but their size and associated symptoms can vary significantly. They are generally described as either symptomatic or asymptomatic. The presence and severity of symptoms dictate the treatment approach. Treatment for urethral caruncles depends on the severity of symptoms. Asymptomatic caruncles may not require any treatment at all, but regular monitoring is often recommended. For symptomatic caruncles, topical estrogen cream can be prescribed to help restore the urethral mucosa and alleviate symptoms. In more severe cases, surgical removal of the caruncle may be necessary. This can be done through various techniques, including excision with sutures, electrocautery, or laser ablation. Pain relievers and antibiotics may be prescribed as needed to manage pain and prevent infection following surgery. Currently, there are no specific preventative measures known to completely prevent the development of urethral caruncles. However, maintaining good hygiene and addressing any underlying urinary tract infections promptly may help reduce the risk. For postmenopausal women, discussing hormone replacement therapy with their doctor may be an option, as estrogen can help maintain the health of the urethral tissues. The prognosis for urethral caruncles is generally excellent. Most caruncles are benign and can be effectively treated with conservative measures or surgery. Recurrence is possible, but relatively uncommon. Current research focuses on further understanding the hormonal and inflammatory factors involved in the development of caruncles and exploring less invasive treatment options. In the future, we may see targeted therapies that specifically address the underlying causes of these growths. Thank you for joining us today.